So in the last class, we were discussing about our electromagnetic spectrum, where it was divided into two parts. This part was X, Y, Z, and these were your high energy radiations. And the remaining this portion were UV rays, visible, micro, radio, and all others. These were your low energy radiations. These were your low energy radiations, and these are high energy radiations. Out of these, cosmic rays are of no use for diagnostic and therapeutic. We are concerned with X-rays and gamma rays. So these two rays, they come under high energy radiations, and this part of the spectrum comes under your low energy radiations. Then we discussed about the X-ray tube and generators. X-ray machine having two components. One component was your X-ray tube, and one component was your generator. Why the use of generator was there? Because whatever we sent, that was AC current. And in case of generator, we are having some system called rectification. Rectifiers are there. So the alternate current is like this. It alternates, sometimes become positive and half of the time it becomes negative. This is your cathode, this is your anode. If you use AC current, then half of the time the electron will move from cathode to anode this time, 50% of time. The next half cycle, they will move like this to the cathode. And during this part, these electrons will damage our cathode. So what we want this system to be directed in one phase. So we use the generator which make the AC current into direct current, so that all the time electron can move from cathode towards anode. So this was the role of the generator with some rectification. And this was our X-ray tube. And inside the X-ray tube, we have seen that the role of this simple tube just to convert electrical energy into the X-ray. If you look at the efficiency, if we are giving 100 input, then this tube will give you 1% X-ray. What happened to the 99% of our input? That will become your heat. It means this tube is of low efficiency, I can say least efficiency tube. Why least efficiency? Because we are giving input 100 and we are getting our result as 1% X-ray. And remaining our energy, our input becomes heat. Inside this system, inside this tube, we have some mechanism to remove this heat. We can remove this with some air, with fan, we have some oil, we have some copper conducting materials, like your anode is connected with some copper, some other materials, or we have tungsten, which tolerate this much heat. So we have multiple mechanisms to remove this heat, dissipate this heat out of the system. But what we are getting 1% X-ray. So this was the role of X-ray tube, and we have entered inside the tube also that this is our X-ray tube and cathode and anode. At this level, what we are giving milliampere. What we are giving milliampere current. Because of this current, similar to our home bulb, we apply current, we switch on, then the filament of cathode become heated up. Because of this heating, what comes out? Electron. So at cathode, what phenomena or what process is taking place? Thermionic emission. Means ions or electrons are generated because of thermionic heating effect. So at cathode, what process takes place? Thermionic emission. So we applied Ma, electron comes out, they form a cloud. To make them, and we want to prevent their spreading, so we apply some cone-shaped structure we call cup, focusing cup, and this focusing cup made up of nickel. So this, up to this point, we have applied Ma, generated electron. Now we want this electron to move toward our target anode. We apply potential difference, which is nothing but your KVP. So KVP is the pulling force which will pull the electron towards the anode. More the KVP, more kinetic energy this electron will gain. They will move towards the anode, and what comes out? Your 1% X-ray. So this we have done, that applying Ma at the cathode and applying KVP in between these two will make the this electron beam to move towards this anode. And after this, we have seen that these are the atoms of our anode, which are nothing but your tungsten atom. These electrons, they will interact with this atom. And the interaction was of two types, that was collisional and number two was radiative. These two types of interaction occur at this place, and that may lead to your 1% X-ray. In case of collisional interactions and in case of radiative interactions, we find that this was the tungsten atom, this is also tungsten atom. The incoming electron, this is the nucleus, positive charge nucleus. Suppose this is the electron. The incoming electron strike or hit or collide. Because of this collision, the electron comes out and there is hole generation. The atom become unstable, electron from outer shell jump to this, and what comes out? X-ray. What comes out? X-ray. This happen in the collisional interaction, but if you look at the radiative interaction, there are 74 positive charges. When this -1 charge move, it will be attracted and it lose all its kinetic energy in the form of your X-ray. So these were two mechanisms. Out of this is the major mechanism. Suppose this will give you 95% X-ray and this will give you only 5% X-ray. There is hit, there is collision, but in this there is no collision. What is there? This an electron which is moving with some kinetic energy, it deaccelerated. Why deaccelerated? Because of this much positive charge. Deaccelerated, or we can call brake. Brake is applied. So brake is applied, it attracted toward the nucleus, and what comes out? X-rays. So these were two processes, collisional and radiative interaction. And in German language, we also call it Bremsstrahlung interactions. Out of these two, which is the major portion, Bremsstrahlung. So in diagnostic radiology, from the X-ray tube, if they ask you in diagnostic radiology from the X-ray tube, which is the major source of X-ray production, is your radiative interaction or Bremsstrahlung interaction. Then we have seen the graph that in case of Bremsstrahlung, we are getting multiple X-rays of multiple energies, a broad spectrum. Some are having less energy, some having high energy. So this was the broad spectrum curve for Bremsstrahlung. But in case of collisional, there are some peaks. These are some of the peaks. So we call them characteristic X-ray. Why characteristic? Because they are or that particular orbitals. So these were peak X-ray, and this continuous part was Bremsstrahlung X-rays. So this was our tube, cathode, anode. There was interaction, collisional, Bremsstrahlung, and what comes out? This X-ray beam of different energies having multiple wide spectrum like your this with some peaks. Out of these, out of this beam, some radiations are having very low energy. We call them soft X-ray. Why soft? Because they will not be able to penetrate the patient. They will get absorbed in. So these soft X-rays, they will unnecessarily increase the exposure dose to the patient. They are not going to reach at this level, at the level of film. So what we did, we added filters, aluminum filters to remove the low or soft X-rays. Then this beam was divergent. This beam was divergent. It means, suppose this was your animal and you want to take only this much part to be radiographed. That is only lungs. But because this beam is divergent, so it will also hit all other cavities, pelvic cavity, abdominal cavity, this neck area. So we want to make it directional, make it more to focus only at this portion. So a divergent thing becomes directional with the help of we call collimator. So these are the devices, collimators and aluminum filters. These devices we put in front of the patient. So if they ask you that where the collimator are placed, in front of the patient or behind, so they are in front of the patient. Aluminum filter. And what is the role of filter? Remove the soft X-ray. Role of collimator to make this divergent become directional so that the area of desired interest to be radiographed. So at this portion we covered in last video, that how X-rays are produced, how the beam is produced, how to remove the X-rays, then making it as a directional. Then now it is going to hit the patient. It will going to strike the patient. So our today's topic is about the how the X-rays, the directional. This is the tube anode. From this, suppose this is the X-ray, and the topic is our X-ray. How does it interact with the patient? The interaction with the atoms which are present inside the tissue of our animal. So this is the tissue of our animal which is having some atoms. So how these X-rays, how do they interact with the patient? So in this video we'll cover the interaction, and after interaction they will come out and will strike the cell. Then we'll see what are the composition of a film, like or cassette, because inside the cassette we have film, then intensifying screen both sides, like this. So this portion will cover that how these X-ray will interact with the matter, interact with the animal, and how do they come out and fall on the cell. So there are two main mechanisms. Just like in the X-ray production tube, we had two mechanisms. One was collisional interaction and one was radiative interaction. Similarly, here we have two mechanisms. That this is our tube and this is the animal and this is the X-ray beam. So how does this beam interact with the atoms of the animal body? So the interaction is mainly of two types. One is your photoelectric effect, and the another interaction is called your Compton effect. So these are the two main mechanisms where your X-rays they interact with the animal body. Suppose this is the atom of your liver or something else, and here also atom inside your liver. X-ray fall on the liver or X-rays anywhere. So this is the case. This is the atom and this is the nucleus. In this case, we will discuss about the X-ray photon. This is your X-ray photon coming out of the X-ray tube and it will interact with the animal body. Similarly, this is the X-ray photon. It will interact with the animal body. In this case, this photon is of low energy. This photon is of low energy. In this case, Compton effect, the photon is of high energy. So the first difference between photoelectric effect and Compton effect is the incoming photon from the X-ray tube, it is of low energy. And in case of Compton, it is of high energy. So we call this low energy interaction and high energy interaction. So cathode, anode, and this was your X-ray beam, and this was your, these two is of two types, that these are your positive charges, make one more, then this is electron and there is interaction. Similarly, there is positive charges and electron. This X-ray photon is this, and this is of low energy. This is of low energy. This photon is this. This is of high energy. High energy. The interaction with this animal, this interaction is the low energy. We call this photoelectric effect. Low energy photon, it will interact with the inner shell electron. In case of Compton effect, high energy photon interact with outer shell electron. So the first difference is this photon which is interacting is of low energy, and this side Compton effect, this photon is of high energy. And the second difference is the interaction with the inner shell, here the interaction with the outer shell. Now, what is the difference between inner cell interaction and outer cell interaction? This inner cell electron is attracted to with the nucleus. This is your high attraction. Means this attractive force is very strong. Because the inner cell electrons are very close to the nucleus, they are attracted more. So this bond or this attraction is strong. But if you look at the outer cell electron, they are attracted with the nucleus, but that attraction is weak. Because there is very distance between the nucleus and the outer shell. So this is weak interaction and this is strong interaction. Low energy, in these two cases, which case need more or high energy photon to remove the electron out? So obviously in this case the interaction is weak, so with little energy we can remove this electron. But in this case the electron is very much near to the nucleus and the attraction or attractive force is so strong that it needs high energy to get out of this orbit. But our photon is of low energy, so what happens? This low energy photon, it will strike here and it will give all of its energy to the inner shell electron. So whatever energy this photon is having, all the energy is transferred to the inner shell electron. So by using this by using this energy, this inner shell electron will come out. We call this as photoelectron. If the electron comes out, then there will be again a hole is there, gap is there. So some electron from outer shell, they will jump here, and during that jumping, the energy will be released in the form of X-ray. In the form of X-ray. So this is the case of photoelectric effect, where low energy photon interact with the inner shell electron. It gives all of its energy to this electron, and that electron will come out. We call that photoelectron. A gap is created. To fill the gap, electron from outer shell jump to the inner shell, and what comes out? X-ray. Because the difference between two shells, suppose this is K and L, the difference is fixed, the energy difference is fixed, and this is characteristic. So the X-ray produced are of characteristic X-ray. In this case, photon comes and emits the outer shell electron. But the outer shell electron is weakly binded with the nucleus. The attraction with the nucleus is very weak. So in this case, our X-ray photon, high energy photon, it will give some of its energy to this, and that electron will come out. The remaining energy inside this photon, that will be scattered. So we call this scatter radiation. Scatter radiation. Because in this case the attraction was very strong, it needed high energy. So whatever energy the photon has, it transferred to this all the energy. So there is no chance of no scatter radiation. No scatter radiation. So this is the main difference between these two effects, that photoelectric effect and Compton, is that in case of photoelectric effect, there is no scatter radiation. This side we have our photoelectric. Suppose this is the inner shell electron, this is the photon, strike and comes out photoelectron, and the electron from outer shell will jump to that gap and comes out your X-ray. So all the energy is converted into photoelectron, or all the energy is converted into X-ray. So there is no or negligible scatter. But in case of Compton effect, if you look at this, there is nucleus, and this is the outer shell electron. This is our high energy photon. It will interact, it will come out, but this attraction was very weak. So this photon will not give all the energy. It is having 100 energy. It will give 30 to remove this electron out, because it's very easy to remove the weak electron. And what is left? 70 energy is left. That energy, that 70 will be lost as scatter. So this is called scatter radiation. So in diagnostic radiology, this is your Compton effect, which gives you scatter radiation. And in diagnostic radiology, when the X-rays interact with the patient body, the X-rays are generated, produced by your photoelectric effect. So what we have started, this was our X-ray tube, cathode, anode. From this what comes out? X-ray, and they have interaction with the animal body. So with this interaction, what comes out? X-rays comes out. And by what process? Which mechanism? Photoelectric effect. Then other thing, we have Compton effect. That will give you scatter radiation. Scatter radiation. So the photoelectric effect will give you X-rays and Compton will give you scatter radiation. The patient body, we have X-ray film. Below the body, we have X-ray film. So this is the film below this animal. Film or cassette, we can say cassette. Inside cassette, we have film and intensifying screen, all that. So these are the X-rays. They will fall on the film and will produce image. This is a good thing. But because of this Compton effect, what comes out? Scatter radiation. Scatter. These are of no use. These scatter radiations are of no use. They will decrease the quality of our image. So how to remove this scatter radiation? See, at this level, above the animal body, there were soft X-rays. So we added filter. Then the beam was divergent. So we added something, collimator. But once they interacted with the animal body, then X-rays are also produced, scatter is also produced. We only want X-ray, we do not want scatter. So how to remove this scatter? Then the concept of grid comes. Concept of grid comes to remove this scatter, so that only the X-rays generated by photoelectric effect, they will reach the film, and at the level of film they interact with the film and produce a good quality image. So something about your scattered radiation. Something about your scattered radiation. So this is your X-ray tube. X-rays come out, fall on the animal, and what comes out? Scatter. ICAR 2019 MCQ. The question was when to use grid. We say that in case of this interaction of the X-ray with the atom will produce scattered radiation. That is your Compton effect. So these scattered radiations, okay, these are produced by the Compton effect and interaction with the animal. So how to remove this scatter? We have something called grid. When to use this grid? That was the MCQ in ICAR 2019. When the thickness of the patient is more than, when the thickness of your patient is more than 10 centimeter. When it is more than 10 centimeter, we use grid. When the thickness of the part to expose that is more than 10 centimeter, we'll use grid. So this was the MCQ. Then in 2020, in ICAR exam, they have asked, first question in 2019 was when to use grid. Then answer was when the thickness is more than. This year they have asked what is grid ratio. What is grid ratio? So before going to grid ratio, we'll see what is a grid. What is a grid? So grid is nothing but your lead lines. We use lead material to absorb the X-rays. So if I make this plate is called your grid. This plate is called your grid. So what is present in this grid or is in this plate? There are some strips of lead. These are the strip of lead. As we know that these lead will absorb X-rays. So when X-ray fall on these lead line or these lead strip, they will be absorbed. So grid is a plate, grid is a material which is having some lead line. So in between this, what is this gap? You can use some material here which allow the X-rays to easily pass. So the space in between this lead line may be made up of some wooden or some aluminum or something else which allow the X-rays to come across this. So this was our animal. X-ray beam was interacted. Then again what comes out? Again a beam comes out. And in this beam we are having two things. One is X-ray and one is scatter. One is X-ray and one is scatter. And this is the film. This is the film. So these scatter are of no use. So we want to remove these. So what we are using grid. When to use grid? When the thickness of patient is more than 10 centimeters. So in this grid, there are lead lines. So suppose this is the these two, 1 and 2. These two are scatter radiation. So the role of these lead strip is to absorb this scatter radiation. And the gap in between these two, this gap will allow the X-rays to cross easily and fall on the film and produce a good image. So this is your concept of grid. When to use grid? When the animal thickness is more than 10 centimeters. Then what is grid? There are alternate lead lines with some material they are placed. What is the function of grid? To absorb the scatter radiation by the lead line. And in the beam we have scatter. We absorb the scatter by the lead lines. In the beam we also have X-rays. So we do not want to absorb this X-ray. So what we do? We allow them to cross. So this we want. But in this way, we are losing something. What is this something? Suppose the beam is having 100 radiations. Out of 100, suppose these are 70 and these are 30. So what we are doing, we absorb 30 and just allowing 70 to fall on the film. So in this way, we are losing some of the X-rays. So to make 100 to reach at the film, we have to increase milliampere so that more number of electrons move from cathode to anode, more X-rays come, and out of if 130 comes, suppose 130 comes, out of 130, 30 scatter and 100 will reach at the film. So, so by using grid, we are losing some of the X-rays, and for to compromise that, we have to increase our exposure. So this was the concept of grid, and then the question that they asked in ICR, that what is grid ratio? What is grid? What is grid ratio? Grid ratio is nothing but the GR equal to H divided by D. Height of this lead strip height, and D for distance between these two. Distance between these two. So this was the simple MCQ. Grid ratio may be defined as height divided by distance between lead line. And the good 4:1 to 16:1. We have a multiple range, but in the exam, if they ask you which is the better one, so remember 8:1 is most commonly used. Grid ratio, that is H by D. Then with the scatter, there is one more concept. This is the beam. This is the beam, and okay, and this is the film. If the angle, this angle with the beam, this angle is less than 90 degree, means suppose angle is 30, it is 35, it is 46. If the angle is less than 90, we call it forward scatter. So two types of scatter radiations are there, just by definition, because in one PSC exam they have asked what is forward and what is the backward radiation. So when this angle is less than 90, we call it forward scatter. Forward scatter, scattering to the sun. But if the angle is more than 90, suppose 120, 130, then this is called backward scatter radiation. So just as a definition purpose, if this angle is less than 90, 30, 35, 40, 48, like this, less than 90, this is forward scatter, scattering toward the film. If it is more than 90, it is called backward scatter. So whatever it is forward or backward scatter, if you want to remove the scatter, we'll use the concept of our grid. Similarly, as we have stationary anode and rotating anode, we also have stationary grid and rotatory or moving grid. Moving grid is also called something like Bucky, or I think it was Potter-Bucky diaphragm. Potter-Bucky. Okay. So this was Potter-Bucky diaphragm. This was your ICR 2017 MCQ. That moving grid is also known as Potter-Bucky diaphragm. So what is this moving grid or stationary grid? See, we use the grid. This is the film and this is the grid. And this is your patient. Because the scatter radiations are the product, are the result of the interaction with the animal body. So scatters come and they are absorbed by the grid. So if you use stationary grid, then on the grid we have these lead lines, which are absorbing the scatter. So these lead lines, they will be seen on the X-ray. This is the bad effect. This is something we do not want. So the problem with the stationary grid will give you lead lines on your final processed image. But if you use the moving grid, the advantage of this moving grid is no lead lines on your final processed radiograph or image. So grid, initially they were using stationary. Grid is used below the patient, above the film, and it absorbs the scatter. And because this is stationary, lead lines which are present on the grid, they will come on the image radiograph. That will further reduce the quality of our image. But this problem is not present in our moving grid, because in moving grid, no lead lines, it is moving very fast, and because of that fast movement on the film, we are not getting any line, just simple characteristic X-rays fall, no scatter, and a good image is obtained. That is your moving or rotating grid. So we started with our X-ray tube, cathode, anode. Then there was interaction. First, collisional. Second, radiative. Beam was produced, and that beam strike on the animal. Inside the animal, two type of interaction: photoelectric effect, Compton effect. This gives you X-ray, and this will give you scatter. This is our film, and to remove this scatter, we have used lead line system. We call them grid. So we remove the scatter. So these are the X-ray. They fall on the film, and they will give you a good image. So up to now, this portion is covered. How they interact, what is photoelectric effect, inner shell electron effect, Compton outer shell will give you X-ray, will give you this what we call scatter. We remove the scatter by grid, fall the X-ray, they will fall on the film, and in the next part, we'll see what happens to our cassette. Means when this X-ray, after removing some scatters, when it fall on the film, which is having both sides intensifying screen, film emulsion, that is AZBR, when it interact with this system, then how the interaction take place and how we get a good quality image or a radiograph. So next video will cover the interaction of the X-ray with the film.
Okay, so thank you.